All right, guys, I want to thank you for listening. Today we're going to be talking about ventilators, specifically ventilator modes. I'm going to use terminology specific to the Zoll Vent because that's what my system uses. I'm going to be just talking about the invasive modes. That's going to be assist control and SIMV. I'm not going to get too much into the non-invasive stuff, bi-level and CPAP. I'm going to do those in a separate video. Just real quick, good housekeeping. I want to make sure that everyone knows this is strictly for educational purposes. This is not medical advice. When it comes to how you treat your patients, always refer to what your protocols, your medical directors recommend. All right. First thing we're going to talk about is breath types. I'm going to use 3 different terms. I just want to go over them real quick just so you guys can better understand what I'm trying to explain. So the first one that we're going to have is a assisted breath. So if it's an assisted breath, it is 100% driven by the ventilator. As far as timing, volume, pressure, all of that's initiated by the ventilator. Spontaneous assisted breath is when the patient triggers the breath themselves. It's outside of the time interval where the ventilator would be triggering a breath. However, all of the volume and pressure is being supplied by the ventilator. Okay, so it's a full ventilator breath triggered by the patient spontaneously. And then we have a supported breath, and supported breaths really only come up in SIMV. What that is it is a spontaneous patient breath triggered by the patient outside of the time interval for the ventilator. However, it does not give them the full volume or prescribed inspiratory pressure. It's just going to give them additional pressure support over what they're doing on their own. Right. So if you have a pressure support of 10 set and the patient's generating 5 centimeters of water of inspiratory pressure, then they're going to get a total of 15 because it's only going to give them that 10 over whatever they're doing on their own. So again, spontaneous assisted, triggered by the patient, full volume and pressure. Assisted, triggered by the ventilator, full volume and pressure. Supported, triggered by the patient, only additional pressure support on top of what the patient's doing themselves. Let's get into the meat and potatoes of this thing. The first mode we're going to talk about is assist control. Okay, so what is assist control? I always like to think of it as A is always assisting, right? So what assist control is doing is it's always going to give the patient a fully assisted breath, no matter what. Okay, so we have our mandatory rate. So let's say you set a rate at 16. So no matter what, that patient's going to get 16 fully assisted breaths per minute, right? However, if the patient is breathing 20 times per minute, it's going to give a fully assisted breath 20 times a minute, right? So it's going to work its time interval to give the 16, but if the patient takes a breath over that, it will immediately trigger a new ventilator breath and give a fully assisted breath. Okay, so when we talk about that, and I'll discuss the contrast between that and SIMV a little bit later in the video. So what we're looking at with assist control is that it allows us to set a minimum minute volume for the patient. It allows us to optimize oxygenation at a minimum for the patient's age. Mostly relevant in patients that are going to be paralyzed right after intubation, or if for whatever reason they have to be paralyzed during transport. The benefit of that is that if the patient is trying to breathe more to compensate for an acidosis that we can't see or catch up from a respiratory acidosis, it allows them to do that, and it gives them the vents full support. One of the drawbacks of being in the transport environment is that we can't see blood gases as readily as they can in the hospital. I know some services, especially in flight, carry them, which is amazing, but you still can't get them as fast as you need the information to titrate the vent, especially in the transport environment. So allowing the patient's brain to do what it knows how to do and compensate and blow off that CO2, awesome tool. That's why you're going to use assist control anytime you place the patient on the ventilator initially, almost 100% of the time. It's going to be the mode that you use almost every single time you put somebody on the vent in the transport environment. The rule of thumb that I like to use and I teach whenever I talk about this is that the only time you should use SIMV is if you specifically know exactly what you're wanting SIMV to do for your patient versus assist control. Otherwise, just use assist control. All right, let's take a few minutes to talk about SIMV. So what does SIMV stand for? It's synchronized intermittent mandatory ventilation. Okay, so we talked about A, always assisting. Assist control with SIMV is S is sometimes assisting, so it's sometimes assisting the patient with the breaths. Really, the hallmark difference with SIMV is that it does the mandatory rate, whatever you have set. However, anything that the patient triggers in between that, it's not going to give a fully assisted breath. It is going to give a supported breath, right? So it's going to get a prescribed amount of pressure support over what the patient's generating on their own as far as inspiratory pressure, right? So just to give you the numbers, if you have a mandatory rate of 16 set in SIMV, and the patient's breathing 24 times a minute, it's only going to give them 16 breaths per minute as far as assisted breaths. So the patient's going to get 16 assisted breaths and then 8 supported breaths if they're at 24 breaths per minute, right? So one of the things that I see when I see people using SIMV is that if your patient is paralyzed, AC and SIMV will perform identically. There's absolutely no difference. However, what it does do is it requires increased effort from the patient, because they have to work harder to get those additional support breaths, right? The vent isn't doing quite as much of the work. It also doesn't give them the same amount of minute volume, right? So if the patient is breathing over what the ventilator is breathing, they're going to get less minute volume in SIMV than they did in assist control. There are reasons that you may want that, and I'm going to go over just really the largest chunk of them here in just a second. But it's important to note that if the patient's over breathing the vent, there's usually a reason. Okay, they need to breathe more. They need to ventilate more than what the ventilator is supplying. Okay, so when would you want to use SIMV? The most common application is when they are weaning people off of the ventilator in the hospital, right? So it allows the patient's respiratory muscles to begin to work. It allows the patient to start to regain some of that respiratory function on their own without being dependent on the ventilator. Really, as far as pre-hospital, the only time that I've come up with that I've personally used SIMV is when you have a central nervous system insult. Okay, so whether this is a intracranial hemorrhage or some type of central nervous pathology like Guillain-Barré, where it's affecting the brainstem, what that can do is give them an irregular respiratory pattern that's not necessarily reflective of what their body needs. So these patients may be breathing 30 times a minute with a CO2 of 15 and they're getting alkalotic because they're breathing so fast. It's not because it's what their body needs. They have a brainstem problem. So central nervous system insult, weaning the patient, those are your primary applications for SIMV. That's going to wrap up the video. I appreciate you guys taking the time to listen or watch the video. I know this was a pretty quick thing. I just wanted to get a little bit of down and dirty on the modes specifically. If you like what you saw, just hang tight. I'm going to try and get more content out there on vents. I'm going to try and just kind of review the basics and then get a little bit more in depth. So I should have quite a bit more content coming. If you enjoyed this, I would appreciate it if you would like and follow. That would be awesome. It just kind of gives me a little bit of feedback about what you guys like and what you guys want more of. So thanks so much.